Mama Lucy Hospital in Nairobi will be upgraded to a level 5 hospital. Nairobi Metropolitan Services Director General Mohamed Badi says the upgrade is one of several measures meant to help the county, which is the epicentre of the COVID-19 pandemic in Kenya. To battle the virus, that is. The NMS has also started the construction of hospitals in informal settlements, and this as the Kenya COVID-19 Fund and Equity Group Foundation today delivered a consignment of assorted personal protective equipment to the Mama Lucy Hospital.
The fight against the COVID-19 pandemic in Nairobi County, the COVID-19 epicenter in the country, has been taken up a notch higher as the Nairobi Metropolitan Services prepare to deal with the pandemic that has seen the number of positive cases on a steady rise. Nairobi Metropolitan Services Director General Mohamed Badi says the county is in a race against time to increase the number of hospitals in the capital. Targeted areas are the informal settlements, which have been overwhelmed by the rising number of COVID-19 cases. 24 hospitals are to be constructed in these areas. This will also ensure that major hospitals within Nairobi are decongested.
We are going to do groundbreaking on Monday, and within 60 days we will have fully furnished hospitals within the informal settlement, treating people of a less advantage or informal settlements.
Mama Lucy Hospital, which receives a huge number of Nairobi residents on a daily basis, will be upgraded to a level 5 hospital. Besides receiving 150 more beds, the hospital will also get an additional 18 ICU beds to help handle the pandemic.
The NMS is working to increase the treatment center, including ICU facilities that will be here at Mama Lucy and Badi Hospital. We are just waiting for the World Bank, who's donating these facilities, to implement them. I think 18 ICU bed facility here at Mama Lucy and 10 at Badi.
During the visit today by the Kenya COVID-19 Fund and Equity Group Foundation, the hospital received a consignment of assorted PPEs to boost the ongoing fight against COVID-19. According to NMS Director General Major General Mohamed Badi, Nairobi has 14,602 COVID-19 cases and 40 deaths from the virus. Of these, 210 are health workers. 4 health centers have been closed, with Badi Hospital operating on emergency basis. Led by Equity Bank CEO Dr. James Mwangi, the team donated personal protective equipment which will last the frontline workers at the hospital for 15 months.
It's really depressing to hear the statistics from Dr. Joycelyn Bai of about 200 medics in Nairobi County having been infected in the course on the line of duty. And it's on that basis that we felt as a foundation, we could work together and complement the FAD with a sum of 1.1 billion shillings to ensure we make our contribution and do a gesture to the medics of appreciation on behalf of the membership of Equity Bank.
I want to assure everyone that the manufacturers will continue to produce quality, you'll see a lot of continuous improvement and innovation happening within the country. And at the end of the day, it will be about job creation and making a difference in our economy as Kenyans.
I believe from today, the health workers in Mama Lucy Hospital and by extension, the health workers in Nairobi will not go on social media and say we don't have PPEs, because the committee is formed by yourselves, the quantities are determined by yourselves, the quality is determined by yourselves.
The team lauded the healthcare workers who are leading the fight from the front line for their selfless service to Nairobians. They commended Kenyan manufacturers for producing high-quality protective equipment at competitive prices.